If you woke up this morning and turning your head suddenly feels like a job your neck has completely refused to do, don't worry, you are definitely not alone. A stiff neck is one of those problems that can appear almost out of nowhere. Maybe you slept in an awkward position. Maybe you spent hours looking down at your phone. Maybe you've been working at a computer all day, driving for hours, or simply held your head in one position for far too long. And the good news is that when a stiff neck is caused by ordinary muscle tension or strain, it will often improve with simple self-care. So in the next few minutes, I'm going to walk you through a gentle routine you can do at home without aggressively pulling, cracking, or forcing your neck. And stay with me because toward the end, I'll show you one very simple daily habit that can help stop that stiff neck cycle from coming back again and again. Before we begin, one important point. This video is for general wellness information, not a diagnosis or a substitute for medical care. If your neck became painful after an accident or fall, or if you have severe pain, weakness, numbness, problems walking, or a fever with significant neck stiffness, don't try to stretch through it. Get medical attention. Now, let's start with something surprisingly important. Don't immediately attack the painful area. If your neck is very irritated, your first goal isn't to achieve maximum range of motion. Your goal is to make movement feel safer and easier. Start by sitting or standing comfortably. Let your shoulders drop away from your ears. Keep your chest relaxed and imagine the top of your head gently reaching upward. Now, slowly turn your head toward the right, not as far as you possibly can, just until you feel the first gentle restriction. Come back to the middle. Now slowly turn toward the left. Again, stay well inside your comfortable range. Notice which direction feels more restricted. And here's the first trick. Don't fight the restriction. Explore it. At about the 1 minute mark, here's something I want you to remember. If a stretch makes you grimace, hold your breath, or tense your shoulders, you're probably asking too much from your neck. The goal is gentle movement, not winning a battle with your spine. Let's continue. Bring your head back to the center and slowly look slightly upward, as though you're looking at something near the ceiling. Only go as far as feels comfortable, then return to neutral. Now gently bring your chin toward your chest. Again, don't force it. We're simply moving the neck through a comfortable range. You can repeat that sequence 3 to 5 times. Look slightly up, return to center, chin gently down, return to center. Then turn slowly to each side again. These movements may look almost too simple, but that's exactly the point. When a neck is stiff, completely avoiding movement can sometimes make you feel even more restricted. Gentle movement helps you maintain mobility while the irritated tissues settle down. Now let's add the shoulders because your neck doesn't work in isolation. Slowly roll both shoulders backward. 1, 2, 3, 4, 5. Then reverse the movement and roll them forward 5 times. Now squeeze your shoulder blades gently together without shrugging. Hold for about 3 seconds and relax. Repeat that 5 times. This is particularly useful if your stiffness is related to spending a lot of time sitting because your neck, shoulders, and upper back are constantly working together to position your head. And here's your next reason to keep watching. The next technique can feel much better if you prepare the muscles first. If your neck feels tight rather than freshly injured, try gentle warmth. A warm shower, a warm compress, or a heating pad on a low setting can help you relax before doing your mobility exercises. If the problem is a very recent strain, cold may also be useful during the first 48 hours. I recommend an ice pack wrapped in a towel for up to about 15 minutes at a time, followed by heat after that period. Never put ice directly against your skin, and never use enough heat to burn or irritate the skin. After warming the area, let's try a very gentle side stretch. Keep your shoulders relaxed. Slowly bring your right ear a little closer toward your right shoulder. Don't lift the shoulder to meet your ear. Stop as soon as you feel a mild stretch along the opposite side of your neck. Hold for around 10 to 15 seconds. Breathe normally, then slowly return to the center. Now repeat on the other side. And remember this, a good stretch should feel mild, controlled, and tolerable, not sharp, electric, or frightening. If you experience shooting pain, tingling, numbness, dizziness, or weakness, stop the exercise rather than trying to push through it. Now let's go back to rotation. Turn your head slowly toward the right until you reach your comfortable limit. Pause for 2 or 3 seconds. Come back to the middle. Then turn toward the left. Pause. Come back. Do 3 repetitions on each side. And here's something important about this exercise. Don't try to make both sides identical immediately. Your neck may naturally feel different from one side to the other. We're looking for gradual improvement, not forcing symmetry. At around the 4-minute point, here's the question I want you to ask yourself. What caused your stiffness in the first place? Because if you only stretch the neck, but continue doing the thing that irritated it, the problem may keep returning. Think about yesterday. Were you looking down at your phone for hours? Were you working on a laptop without proper support? Did you sleep in an unusual position? Did you drive for a long time? Did you suddenly increase your exercise? Or have you simply been under a lot of stress? These are all common situations associated with neck discomfort and stiffness. So let's fix the environment, not just the symptom. If you're working at a computer, try to keep the screen around eye level. Support your back. Let your shoulders stay relaxed. And instead of keeping your neck in exactly the same position for hours, change position regularly. If you're using your phone, bring the phone upward rather than repeatedly dropping your head downward to look at it. That tiny change can make a surprisingly big difference over the course of an entire day. And now, here's the part many people overlook. Your neck doesn't necessarily need more stretching. It may need more regular movement. Imagine sitting at a desk for 3 hours, then suddenly standing up and aggressively stretching your neck for 2 minutes. That's not necessarily the best strategy. A better approach is to interrupt the long period of stillness. Every so often, stand up, roll your shoulders, look gently left and right, take a few steps, change your position. You don't need a complicated exercise program. You need to stop asking the same muscles and joints to remain in exactly the same position for hours. At about 6 minutes, here's your next hook. Try this 1-minute neck reset with me right now, and you can repeat it during your workday. Sit tall. Take one slow breath in and breathe out. Turn your head gently to the right, center. Turn left, center. Look slightly upward, center. Bring your chin gently downward, center. Now roll your shoulders backward 5 times. And finally, let your arms hang loosely while you take another slow breath. That's it. You can repeat this little sequence during the day, staying within a comfortable range. Now, what about massage? Gentle massage of the neck and shoulder muscles may help some people with tightness and discomfort, particularly when muscle tension is contributing to the problem. But again, gentle is the key word. You don't need to dig your fingers aggressively into the front or side of your neck. Instead, you can gently massage the upper shoulder and the muscles around the back of the neck. If it feels soothing, continue for a short period. If it increases your pain, stop. And I want to address something from the original type of towel exercise you may have seen online. A towel can certainly be useful as a comfortable support, but I don't recommend using it to aggressively pull, rotate, traction, or manipulate your neck yourself. Your cervical spine contains important nerves, blood vessels, joints, and other structures. A wellness video should not encourage viewers to force those structures into position. Instead, use your towel for warmth, comfort, or gentle support, and let your own muscles control the movement. At around 7 minutes, remember this: you don't need to crack your neck to make it better. That popping or cracking sensation is not proof that a vertebra has gone back into place. What matters more is whether your pain and movement are gradually improving. Now let's put everything together. If you wake up with an ordinary stiff neck, start gently. First, assess your comfortable range of motion. Second, use warmth if it feels soothing, particularly when muscle tightness is the main problem. Third, move the neck gently through rotation, looking up and down, and side to side movement. Fourth, move your shoulders and upper back. Fifth, change the position or activity that may have triggered the stiffness. And finally, give your body time. Most mild to moderate neck pain improves with simple self-care, although recovery can take days or sometimes a few weeks depending on the cause. And now we're at the point I really want you to remember, because this could save you from repeatedly dealing with the same problem. Don't wait until your neck hurts before you move it. If you spend most of your day sitting, build small movement breaks into your routine. If you use your phone frequently, raise it closer to eye level. If your workstation forces you to look downward, change the setup. If stress makes you tense your shoulders, periodically notice that tension and consciously let the shoulders drop. Prevention is often much easier than trying to undo hours of accumulated stiffness at the end of the day. And one final safety reminder: a routine like this is appropriate only for the kind of ordinary stiffness that can reasonably be managed with self-care. You should seek urgent medical attention for severe neck pain after an accident or significant injury, or if neck pain is accompanied by weakness, difficulty walking, significant numbness or tingling, or other neurological symptoms. A stiff neck accompanied by fever, severe headache, vomiting, confusion, marked sleepiness, or sensitivity to light can also indicate a serious infection. Don't try to stretch those symptoms away. And if your neck pain is persistent, keeps getting worse, repeatedly comes back, or isn't improving with self-care, speak with a healthcare professional or physiotherapist so the underlying cause can be assessed. So, if you are dealing with a simple, stiff neck today, start small. Warmth, gentle movement, relaxed shoulders, Better positioning, regular movement breaks, and patience. Your neck doesn't need to be forced into submission. It needs the right amount of movement, support, and recovery. If this routine helped you, subscribe to Auralith Wellness for more practical, evidence-informed ways to take care of your body naturally and safely. And tell me in the comments, did your stiff neck come from sleeping, working at a desk, using your phone, exercise, or something else? Your answer might help someone else recognize what's causing their own stiffness. Take care of your body, keep moving gently, and I'll see you in the next Auralith Wellness video.